Hi everyone, I'm Dr. Akhila, consultant fertility specialist to the hospital Banjara Hills, Hyderabad. Today we are going to talk about premature ovarian failure. So, what is the definition of premature ovarian failure? When when the ovary stops working before the age of 40 years, that is when it is premature ovarian failure. So, the female can have very few to no eggs and have scanty period or irregular cycles. Now, this is different from premature menopause, where where the cycles absolutely stop. She gets no period, and premature menopause she cannot conceive naturally whatsoever. That is the difference between premature ovarian failure and premature menopause. So, in premature ovarian failure, the hormones, that is the estrogen, keeps falling, and that is how the egg count also is much less. The most important effect of this is infertility, which is not able to conceive. The other effects of this is osteoporosis and some heart diseases. These are the other effects of premature ovarian failure. What other symptoms that she may experience is definitely irregular cycles, inability to conceive, hot flushes, vaginal dryness, anxiety, depression, lack of concentration. These are some of the symptoms that are associated with premature ovarian failure. Coming to what are the different causes of premature ovarian failure. So there can be some iatrogenic causes like chemotherapy, radiotherapy, ovarian surgeries, or genetic causes like mosaic Turner or fragile X syndrome, autoimmune causes wherein the body's own antibodies act against the ovarian reserve. The last but not least is the idiopathic cause, where we don't identify a typical cause for this premature ovarian failure. And the risks, as I have already told, is that of there is infertility, there is a risk of osteoporosis, weak bone, multiple fractures, and there is also a risk of certain heart diseases because once the estrogen level is coming down, these are the different risks that a patient can have who is suffering with premature ovarian failure. Now, how to treat this premature ovarian failure? The diagnosis, as I've already told you, it can be through a scan and certain hormonal blood tests like FSH and estrogen. Based on this, we can come to a conclusion, clinical diagnosis along with biochemical and radiological diagnosis. Now, how to treat this? The most important treatment is that of a hormonal replacement therapy, wherein we give her estrogen and progesterone to continue the normal hormonal balance in the body, which also regulates her cycles, which maintains the bone health and the cardiac health. We supplement these kind of patients with calcium and vitamin D. Regular exercise and healthy diet is definitely recommended. When it comes to fertility, IVF is the best treatment for these kind of patients. The ones who have few or minimal eggs, we can go through a self cycle idea. The ones who have very, no eggs or one or two, or who have failed IVF cycles, maybe we can opt for the donor IVF cycle, donor decide IVF cycle. So this is all about premature ovarian failure. Any questions, please? Can we take medications for this? Yes, I have already told you the most important medicine that you must and should take is estrogen, that is and progesterone, which is in the form of hormone replacement therapy. This can be continued to an age of up to 50 years. That's when there is natural menopause. The condition, is it reversible? It can be managed with treatments, but the egg reserve is something which is definite. If the reserve is less, there's nothing much we can do to improve that reserve. 24 years in PCOD treatment, uh, I would not, I would not. So this is a little PCOD or is it premature ovarian failure? So the treatment for premature ovarian failure, I repeat, is hormone replacement therapy. If you're looking for fertility, it is definitely IVF, healthy lifestyle, good diet. You can add calcium and vitamin D supplements. This is the treatment for premature ovarian failure. In premature ovarian failure, it is not that they cannot conceive naturally, but it is the chances are very less, and IVF is a better modality. I want to see that question again. I couldn't see that question, but anyway, next question, please. Yeah, I haven't had my period in over a year, even though I was on medication. I pushed through myself, which was supposed to. Then we keep return. Uh, when it comes to chemotherapy, we need to do certain blood tests and scan to figure out how many follicles are there and what are the hormone levels. Based on that, we can let you know whether you can have a. Normally, after chemotherapy, if the damage is not much, some women can have a return, but it depends on what the hormone levels are, and accordingly, we should plan your cycle. And the treatment of premature ovarian failure I've already discussed. A scan is a must to understand what exactly is happening. If you've not had periods for 8 months, is what I can understand from the question. A scan, and thereafter we can let you know what the treatment is. So this is what I said, premature ovarian failure is different from natural menopause. In premature ovarian failure, there are chances of conception, though the chance is very less. When it comes to natural menopause, obviously there is no chance of any conception in those kind of women. But IVF is a better modality for fertility when it comes to premature ovarian failure. There is a genetic aspect definitely related to premature ovarian failure. Some conditions like mosaic Turner's fragile X syndrome, these are some of the genetic conditions wherein patients experience this. So a karyotype needs to be done. Uh, Scanty periods can be because of many things, not essentially premature menopause or premature ovarian failure. Even people with PCO can have scanty periods at times. People with thyroid problems, prolactin problems, there are plenty of reasons for this that needs to be evaluated. For vagina, hormone replacement therapy is the best treatment to set these kind of symptoms.